Well, other than the GP, of course, there's a whole range of people that can assist with advanced care planning. And in fact, the GP shouldn't be the only person to do so, I think, unless there's some reason for that to happen. So particularly, I think, we're looking at nursing people who may well know the patient very well, community nurses or the general practice nurse, or perhaps the social workers. Often the social worker may have been involved with the family for some reason beforehand. Psychologists, of course. But then there's a huge range of allied health professionals who may just have an opportunity to discuss some part of it. For example, a podiatrist might say, look, you're heading in the direction of not being able to walk well in the future. You need to think about how you're going to manage this into the future. So as allied health professionals interact with people, the dentist might say, look, I understand that you're being looked after by your daughter. You might be moving into residential aged care. We could probably do some work on your mouth that will make that much, much easier to handle, that transition. So there's a whole range of people who can help with the advanced care planning.
And like I said, she had a really great social worker who, I guess, raised the topic of filling out the document. So whilst we'd had lots of conversations in lots of different settings about what gave her life meaning and what she didn't want to live with and all of those kinds of things, actually filling out the paperwork, it wasn't really well accepted when it came from me. It was much more accepted when the social worker suggested it, and it was easy for Mum to choose me, but actually filling out that legal documentation, it was the social worker who introduced it.